Hi, this is Tim Needham with Burwood Group here at the February version of the Healthcare Technology Leadership Forum. I'm sitting here with Rosemary Kennedy. Rosemary, would you mind giving a quick snapshot of your background?
Sure. Rosemary Kennedy. I'm the Chief Nursing Officer for Sotera Wireless. I've been a nurse for about 30 years. My background is focused on health information technology, implementation of electronic health records, data standards. I was at the National Quality Forum working on quality measures for meaningful use, and here I am working at Sotera.
Nice. So first question for you. Looking back 10, 15 years, healthcare IT, a lot of promise around delivering benefits to frontline caregivers, nurses specifically. A lot of wins in that time, a lot of disappointments. Looking forward, next 5 to 10 years, is there anything on your radar that you think we can finally really recognize and drive some benefits to those frontline caregivers and deliver on the promise of technology facilitating the job they have to do every day?
Yeah, I think there are quite a few emerging technologies to address the needs of nurses at the point of care, and I think as you look at the technologies, they've been around for years, but I think we're at the point now where the price point of those technologies are such that they can be adopted and integrated into healthcare delivery. If you look at the technology, then most organizations are under tremendous pressure to show a return on investment, to show the efficiency aspect, quality, and safety. And I think now we're seeing a perfect world where it's all kind of coming together. The technology, the price of it starting to decrease. The Institute of Medicine has identified key areas for safety improvements for which nursing has a significant impact on. For instance, in terms of nursing surveillance and complication detection in medical surgical units, 78% of those interventions are carried out by nurses, which has a huge impact on failure to rescue and reducing complication rates. And for that reason, given that the price point is coming lower and these organizations get reimbursed based on these outcomes, they want to reduce complications, reduce transfers to the ICU, reduce resource consumption for DRG, decrease readmissions. I think we're seeing the technologies having the capability to have an impact in all of those areas.
It is nice to see the technology costs coming down while the regulatory pressures are lining up. Maybe we finally make it happen, right?
Yeah, and all of those areas that the regulations are looking at, the Institute of Medicine, the quality measures coming out, pay for performance, value-based purchasing. If you look at some of those measures and metrics that we're trying to achieve, they're very closely aligned with nursing practice. We want to identify complications early. We want to prevent and early detect in a very early fashion patient deterioration. So there are probably, some technologies that come to mind. Obviously, the electronic health record has played a role, but I think with smartphones, I think with non-invasive kind of monitoring technology, we're able to move into a space where we can move the needle forward. Some of the emerging technologies related to diagnostics have been there. You can detect non-invasively a patient's blood sugar.
Right.
Treatment, you have smart medications. You have all sorts of technology to detect whether a patient's compliant or not. In the area of surveillance, until recently, we haven't had that many innovative technologies. And, 50% of the deaths that occur in hospitals anyway occur in non-monitored beds, medical surgical beds. So there's an opportunity to use this technology to make a difference in those
Cover more of the population.
Cover more of the population, whether it's medical surgical beds. Today I spent some time with home care nurses. They go into the home, they do infusions over 4 or 5 hours. They need to capture primary data, and the technology is innovative, but the data that provides early signs of deterioration relates to vital signs. I mean, you can't get much more basic than that: blood pressure, heart rate, pulse, EKG. So if we could continuously capture that data, alert a nurse that something's wrong. Typically in those areas they have 5, 6, 7 patients, and they can get an identification that there's something wrong with the patient and intervene. What does that mean? Patient gets care sooner. Maybe they're not transferred to the ICU. They can stay in that level of care. We call rapid response. Rapid response has access to additional information, trended information to make a decision.
Okay, good. Thanks for those insights. Appreciate it. Last question for you. So you were here at our last Health Technology Leadership Forum and came back.
Yes.
So tell me a bit about your perceptions of benefits to the providers who join us here, some of your insights just based on having been here before.
I think I loved the last forum. I came to
Good.
the last forum and I enjoyed it, and I think for three major reasons. I think rich conversation, so it's a safe forum to talk to people about healthcare challenges and opportunities and get some really rich exchange of information in terms of what they may be doing at their facility, or if they work for a company with technology they're developing. So I think it's a safe forum, too, to test new ideas. And I kind of, there are a few forums that you go to that you generate new knowledge as a byproduct of the conversation. So you can always share best practices, but I felt like we left and we generated new ways of thinking about things, and we generated new knowledge based on our conversation. So it's rare, you go to forums and you talk, and it was rich and deep and generated new knowledge. I walked away with ideas about how to think about things that I hadn't thought of before I walked in.
That's good. That's about the best we could hope for. So, all right, well, hey, appreciate the insights. We'll get on to the forum, but thanks again for stopping by.
Okay, thank you. Enjoyed it.